right, it's Balance Awareness Week here in the United States of America. It's Balance Awareness Week, so we're putting together a series talking about balance and why it is important to you. Hey everybody, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything audiology.
And if you're not sure what audiology is, make sure to like and subscribe to our channel, hit the notifications bell, and we're going to tell you all about it.
What is happening? All right, so it's Balance Awareness Week. So we thought it would be a great time to talk about balance and what does balance and dizziness have to do with audiology? Well, we're going to talk about that today and introduce you into a series where we get really detailed with why that is, what we do here at our office, and some collaborative efforts we have with other professions that can help you if you have anything going on with your balance.
Right, so I think the first thing that's really important to talk about is why is balance important at all? And, you know, we think about balance in terms of like, you know, walking on a balance beam, right? And it's not always about that.
Mm-hmm.
We're talking about balance in terms of being able to just move about your world in an independent way, but also about things like fall risk. And, you know, one of the things that we as a culture in the United States think about and across the world is staying as independent as we can for as long as we can.
Right.
And keeping up the healthcare, our healthcare as individuals in terms of balance is just one of those ways of maintaining that independence.
Right. And I mean, one of our most common reports that we get just talking with anyone in that case history time and getting to know our patients is people are dizzy. People either feel dizzy, like true vertigo where the room is spinning around, or they just feel a little bit unsteady, or they're worried they're going to fall, or they just feel off, or like they're in a fog. Those are all very common reports, and probably the question that most people think or ask me is, what do you, as an audiologist, have anything to do with my balance?
Right. Well, in terms of the centers within the ears that we are assessing, the balance and the hearing organs are very closely related to one another. In fact, they share a fluid system. So when we're testing one, in some ways we're testing the other. And in fact, as part of the balance assessment, we should be checking the auditory system as well, because there are some disorders that relate one to the other or coincide. So in terms of why we're involved, it's because of what we do. We're so involved in the diagnostic aspect of the auditory system, and your balance centers in each of your ears are part of that auditory system.
A very common question that both of us get asked is, what does my hearing or my hearing loss, my untreated hearing loss, have to do with my balance?
Yeah, that's actually a really good question, and I think people are becoming more savvy consumers of healthcare these days, so they're starting to understand some of the correlations. There's a great study out of Johns Hopkins that relates untreated hearing loss to balance issues. And what they found is that even a mild hearing loss, which for those of you who know what an audiogram looks like, 25 decibels starts a mild hearing loss. If you don't know, go back and read and watch some of our other videos. But a mild hearing loss will increase the risk of falling by 300%. 300%, that's 3 times the risk of falling. And what we know for individuals over the age of 65 in the United States is that falls are the leading cause of accidental death and injury, and one of the leading charges to Medicare in the United States. So falls are no joke. It's not something that anybody really wants to mess with. I think if anybody were interviewed and said, hey, would you like to fall today? I think everybody would say no. But there's something that we can do about it.
Right.
People shy away from treating their hearing loss without understanding the actual implications of an untreated hearing loss. So going back to that study, it shows that an untreated hearing loss actually takes away or kind of hogs the energy from the brain. And when the brain is allocating so much energy to that one area, trying to hear and trying to gain spatial awareness, then it steals energy away from other areas, including the balance centers of the brain,
Right.
which then leads to a higher or an increased risk of falling.
Yeah.
So
I think too, it's easy to, if you think about it in terms of our bodies are all connected. We all say that. If you think of it in a holistic way, one thing definitely affects the other in terms of bodily functions and systems. And then, like Michael said, we only have so many resources really available and so much energy that we can put toward one thing. And if you're lacking, as he said, in your hearing, and we've got a reduction there, it may be possible that you've got a reduction or dysfunction in your balance system as well.
Right. And it's really important to remember that there is hope. Many of the studies that are coming out, including those from Johns Hopkins, also indicate that treating the hearing loss can reduce that risk. Now, it doesn't make it go away because the hearing loss is still present, but reducing that risk by 50% or more in some cases, and which is just so important. If we can reduce the risk of anything by 50%, it's well worth the investment in time and energy in treating that issue.
Right. We did an episode, I think we called it Cognitive Load.
Right.
Go back and watch that because it goes into detail about some of these processes and exactly what we're talking about here.
Yep, exactly.
And as we move forward in this series, we're going to talk about the testing that we do here and what we're looking for and why it's a good idea to actually have the testing rather than just maybe jump to a medication or something like that to try to treat it. And then we're also going to talk about our collaborative efforts with physical therapy, and specific Mountain River Physical Therapy here in Parkersburg, and how we work together as audiology and physical therapy to diagnose and treat that balance disorder.
Right. The main underlying thing is if there's a problem, let's do something about it, whether it's hearing or balance or both.
Right.
Want to wrap it up?
I just want to keep talking all day.
No,
I'm just kidding.
I'm going to leave.
Okay, everybody. Thank you for joining us for our first episode in our Balance series for Balance Awareness Week. And we're just going to stretch this out over a few weeks and make it Balance Awareness Weeks, I guess.
Weeks, month.
Month, maybe.
Year.
But stay tuned. If you have specific questions about your balance, let us know. Now's a good time and we can address those questions throughout this series. And look forward to our next episodes where we're going to dive in deeper, like I said, about testing, why we're doing it, and who we're treating with. So if you have questions, email us, info@hearwv.com. Call our office at 304-428-2403.
And also, if you liked what you heard or saw, make sure to like and subscribe to our channel, hit our notifications bell. It helps us out and grows our channel. And until next time, see ya.